Well, now on our Feed at 4, we have some good news on the COVID front. How about that headline? Cases, hospitalizations, and ICU admissions have dropped, and they've dropped a significant amount over the past week.
Yeah, listen to this. 7,900 new cases were reported in the last 7-day period. That's about 2,700 fewer than last week. There were 212 fewer hospitalizations and 22 fewer ICU admissions. So COVID put public health in front of us, but the pandemic also caused thousands to leave their careers in exhaustion.
Yeah.
We've heard about this, and we saw what they went through.
Societally, what a disruption. I mean, aside from the human loss, it seems like everything has been upside down since this pandemic began, which is now almost 3 years ago, which is really hard to believe. Now there's a new federal grant trying to boost the workforce. Senior health correspondent Monica Robbins joining us now on the set of What's New. Monica, good afternoon to you. What can you tell us about this?
We need more. That's what I can tell you from the beginning.
Right.
Yeah. Well, you know, it is no secret. The pandemic and then the follow-up, remember the viruses with RSV and flu, just making our healthcare workforce exhausted. But public health has long had a workforce shortage and been underfunded. Now the Department of Health and Human Services is giving Case Western Reserve University $1.5 million to provide scholarships to 51 public health recruits who will help bolster the workforce at the Cleveland Department of Health. And for those looking to expand their education, this is a huge deal.
This program offers a full scholarship, either for a course or series of courses, all the way to a certificate or a full Master's of Public Health degree. The Master's of Public Health degree is a terminal professional graduate degree in the field of public health, and individuals who are eligible and selected for this program will receive full tuition for that at Case Western Reserve University School of Medicine.
Yeah, that's huge, and it doesn't come every day. And those interested must hold a bachelor's degree and be working at an approved local public health agency. And I put a link to the application on WKYC.com. You don't see this every day.
No.
51 people can get a full ride, essentially, if they want to go into public health. And this is a project that is trying to make public health experts find those people who can get even more information and be specialists in their field.
Every little bit helps, but really in the grand scheme of things, 51 seems like a dent in what we need, really, because so many left the field.
Absolutely, yeah, up to 40% left the field since the the pandemic began.
I have a question for you, because I have some friends that fell into this group. They didn't want to get vaccinated. They just, for whatever reason, they chose not to, and the profession said, no, you have to. Is there ever a chance that the profession can accept those people back? Because it feels like our stance on mandatory vaccines has changed dramatically.
You know, in healthcare, though, mandatory flu vaccines are still in place.
Right.
So I have no doubt that COVID discussion is likely happening. But if flu vaccines are already mandated, I'm pretty sure as long as they're adequate, usable COVID vaccines, they might stay in place as well. But, it's going to be a wait and see.
Interesting.
And it's something, it just is so indicative of illustrating to us how desperate they are to get these people, how much they're needed. Thank you so much, Mom.
Sure.
Always appreciate it.